Welcome to Marriage and Family Play Therapy. This is Terry Kottman's book, Partners in Play. We're going to be overviewing this book chapter by chapter. Looking at chapter 1, overview of play therapy. Kottman says play therapy is an approach to communicating therapeutically with clients using toys, art materials, and other play media, giving clients a safe, nurturing relationship in which they can explore, express their feelings, gain insight to their motivation, interactions with others, learn and practice socially acceptable, appropriate behaviors. This is Kottman, Landreth, Thompson, and Rudolph, 2002, and also in 1991. The natural language of children is play. Much of what children do or clients that are involved in play therapy interactions is symbolic, metaphoric communications about relationships and situations in their world. The definition for play therapy, according to the Association for Play Therapy, is the systematic use of a theoretical model to establish the interpersonal process in which trained play therapists use therapeutic powers of play to help clients prevent or resolve psychosocial difficulties, achieve optimal growth and development. That is a quote by Charles Schaefer, one of the founding fathers of the Association for Play Therapy. The therapeutic powers of play: overcoming resistance, communication, competence, creative thinking, catharsis, role play, fantasy, visualization, metaphoric teaching, attachment formation, relationship enhancement, positive emotion, mastering developmental stages, and gameplay. Quite a lot. In this book, it talks about applicable for children age 3 is the youngest age, up till 10. Much research has been done for adolescents and adults, so please make sure that you do not leave those particular populations out. The rationale for play therapy. Through the manipulation of toys, the client can show more adequately than with words how they feel about themselves, significant people, events in their lives. That's also from Kottman. And if you look at counseling and through play therapy interventions with children and adolescents can be very resistant, refuse to speak. Children can maybe present with the inability to master language. Some clients who are less cognitively able may not be as comfortable with verbal communication. Children on the ASD spectrum or other clients in the ASD spectrum may not be able to do traditional talk therapy. And with the ASD spectrum, the receptive language skills, what I understand you to say to me, may be much, much higher than the expressive language skills, what I'm able to communicate back to you. If you're looking at the family play therapy room, toys should be family nurturing. I'm looking at Adlerian play therapy, which is what Terry Kottman operates from and where this book comes from, are to assess and treat the crucial C's: connection, capability, counting or significance, courage, and also to have some control and autonomy. The family constellation: what is the family like? What is the birth order? The family atmosphere, earliest recollections, goals of misbehavior. Family and nurturing toys is one category, and they give you examples of them. Scary toys, things that I'm afraid of. With your family toys, you need to be culturally specific, both across age, gender, culture, race, and ethnicity, and have some toys that are not gender specific as well. Maybe some things without faces. Scary toys, these are things that have caused me fear and anxiety. Aggressive toys, things that cause me anger. Expressive toys, things that I can use to do art or construct things. Pretend and fantasy toys. Things that exist within the realm of magical thinking, which many children and other types of clients exist. Another category for toys that is sometimes lumped with pretend and fantasy toys or spiritual toys crosses other kind of spiritual figures, biblical figures, Jesus, Moses, any of those kinds of things, the Star of David, any other symbol of any other type of faith system that you wish to include. So the toy, and those are listed for you on pages 3 through page 9, as well as a list of these in your resources in the Google Classroom. The toy arrangement, they should be within easy reach, separated, not just dumped in a bin in a predictable place, with shelves grouped according to category. The setting, it should be ample space, things that are built in, things that are very easily cleaned, things that are child or client friendly and safe. The ideal playroom, about 12 feet by 15 feet, according to Dr. Landreth. Sometimes windows and mirrors are helpful. Washable wall covering, ideally a sink with some cold running water without potentially dangerous hot water, cabinets for storage, furniture that's applicable for the clients that you are going to see. Separately from that, there is an option for classrooms, for conference rooms, and for offices that have made spaces for that. Looking at the research on page 12 and 13, any client is suitable for experiential integrative interventions, which is what play therapy ultimately is. Play therapy is a treatment of choice for adjustment disorder, post-traumatic stress disorder, dissociative, depressive, specific fears and phobias, trauma, abuse, neglect, anxiety, depression, divorce, acting out behaviors, family violence, hospitalization, chronic or terminal illnesses, hospitalization, or any other type of issue that presents itself in session. Try it. The very strong likelihood is that you will enjoy using it and see a great deal of success with your clients.